welcome to week 37. In all likelihood, your little one is now in the head down or vertex position in preparation for delivery. 97% of babies are head down by 37 weeks. If you have a stubborn child who's still not head down yet, I encourage you to check out the YouTube channel Spinning Babies. They will give you some exercises that you can do to help encourage that baby to get properly positioned for birth. You should still be feeling fetal movement every single day. Your little one is starting to run out of room, so those kicks may not be as crazy as they once were, but you should definitely be feeling something. Your pregnancy is now considered term, so you could go into labor anytime now. How would you know you might be in labor? You are having contractions that are so strong that you cannot talk through them. A lot of patients ask me, how will I know I'm having a contraction? The best way that I can describe it is if you've ever had a painful menstrual cramp, it's that, but much worse. If you've never had a painful menstrual cramp, but you've had a Charlie horse in your leg, imagine that Charlie horse in your belly. If this is your first baby, you are having those contractions every 5 minutes for an hour. If this is not your first baby and you are having contractions that are taking your breath away, please call your OB. If you have water running down your leg that isn't urine, if you are bleeding enough to saturate a pad, and of course if your baby isn't moving, you need to notify your provider. We are still on the lookout for preeclampsia. Statistically, preeclampsia tends to happen at 37 weeks and beyond. Women with preeclampsia have very high blood pressure, which can be harmful for both you and the baby. Symptoms for you to be aware of: the worst headache of your life won't go away no matter what you do. Changes in your vision, black spots, flashing lights, tunnel vision that occur at rest. If you are having burning behind your right breast, normal heartburn is up here where your esophagus is. Preeclampsia affects your liver, causing a burning sensation. Your liver is located behind your right breast. Do you have a visit coming up this week? Typically, you're being seen about every 1 to 2 weeks at this point. Your provider's going to want to measure your tummy with a tape measure. Centimeters should match weeks, plus or minus 2. You may not see a significant rise this week because that baby is settling down into your pelvis, so sometimes those numbers may actually go down a little bit. They're going to listen to the baby's heartbeat with a Doppler. Normal heart rate is anywhere from 110 to 160 beats per minute. If you have not already had your Group B strep test done, they'll want to collect that. Group B strep is a normal bacteria. 25%, 1 out of every 4 people, colonizes or grows it in their digestive system. It's a normal bacteria found in poop. The problem is, it's very harmful to babies, so we test every woman, every pregnancy. It is a dry Q-tip, it goes in your vagina and down by your booty hole. Very awkward. If it comes back positive, you will get antibiotics in labor. The antibiotics are not for you, they're for your baby. So what should you be doing at this point? If you have not already downloaded a labor app, I encourage you to do so. Have you started packing your hospital bag? Now's a good time to do that. Have you been writing down your questions to ask at your next visit? I hope so. In the meantime, if there's any questions that I can answer for you, please drop them in the comment section below. While you're down in that comment section, I'd love it if you'd hit that like button.
You're still here. Thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.